Good day, I'm Cyril Morante, Chief Nurse at Dr. Ramon Vigustilo Hospital. Today, I'm going to present my thesis study entitled The Working Environment and Well-Being of Nurses in Northern Negros Occidental Hospitals During the COVID-19 Pandemic. Rationale of the study. The study determined the level of the quality of the working environment in the areas of organizational management, facility management, and human resources management. Also, it will assess the extent of well-being of nurses in terms of physical, social, emotional, intellectual, and spiritual health. Likewise, it will identify the challenges encountered by nurses in the work environment. Additionally, it explored the difference according to the variable sex, employment status, nursing experience, and hospital affiliation. Moreover, it seeks to establish the relationship between the working environment and the well-being of nurses in Northern Negros Occidental during the COVID-19 pandemic. The findings of the study will serve as guidelines in designing a proposed wellness program to improve the overall well-being of nurses. Methods. This quantitative research used descriptive, comparative, and correlational research design approaches. The respondents of the study were 130 nurses selected from four hospitals in Northern Negros Occidental. From the total population of 193, the sample size was determined using stratified random sampling techniques. Two research instruments were utilized. A research made instrument based on the Department of Health Guidelines Assessment Tool 2080 was used to gather data about the working environment, and a standardized questionnaire for the well-being assessment tool checklist was used for the well-being. The respondents were asked to rate the responses using the 5-point Likert scale for work environment, while well-being using the 4-point Likert scale. The descriptive, comparative, and correlational analysis were utilized using percentage, mean, Mann-Whitney U-test, independent sample t-test, and Spearman rank correlations. Summary of the findings. The overall assessment of the level of quality of the working environment of nurses in Northern Negros Occidental Hospital was high. The mean is 3.75 and standard deviation is 0.77. It means that the organization was well planned and prepared for the emergency, particularly the attack of the COVID-19 pandemic. They provide policies, protocols, procedures, and committees. Human resources produce enough personnel and provide accurate staffing schedules and annual plans for training and development activities and the use of personal protective equipment. Likewise, in facility management, the hospitals have appointed a safety officer to ensure the policies and procedures for the safe use of medical equipments and supplies are in place, and also the prevention of infection in the hospital. The extent of the well-being of nurses. Generally, the assessment of the extent of the well-being of nurses in terms of physical, social, emotional, intellectual, and spiritual health as great. The mean is 3.11 and standard deviation is 0.50. This concludes that they are happy, contented, and satisfied that their environment meets the expectations required to render service to the patient. Among the five aspects of their health, spiritual health was weighted to a very great extent, which means that nurse relied on the divine intervention of spirituality, particularly during this time of pandemic. While physical health is the last rank among the domain, it denotes that managers must plan and implement a program to prevent mental health problems like burnout, anxiety, depression, and fear, to render quality care and patient safety. In terms of the variables, employment status, the probationary nurses rank higher compared to permanent nurses. The results imply that hospital management may value and recognize nurses even if they are probationary or contract workers. The difference in the level of quality of the work environment of nurses. The Mann-Whitney U-test was used to determine the significant difference in the level of quality of the work environment of nurses. The findings revealed no significant difference in terms of sex, employment status, nursing experience, and hospital affiliation. The hospital complies with the health and safety standard in the workplace by giving its personnel the appropriate protection against hazards since it is the responsibility of the institution. The difference in the extent of well-being of nurses. The independent sample t-test was used. Thus, the overall findings revealed a significant difference in employment status. The p-value is 0.021. Consequently, the null hypothesis is rejected. The results indicate that even though the overall well-being of nurses was to a great extent, there is still a need to be alert and uphold with the issue in the workplace that may lead to dissatisfaction, disinterest, and change of job, and eventually result in resignation. The organization may implement a program to ensure the security of every person in the hospital. Relationship between the working environment and well-being of nurses. Spearman rank correlation was chosen. The findings revealed a significant relationship between the working environment and the well-being of nurses. The p-value is 0.000. The findings generally indicate that a positive and healthy work environment is an essential factor so that nurses have a better quality of life, leading to a good performance. With high quality and a great extent of the well-being of nurses in this study, it represents that the hospital management has to continuously consider and observe other aspects that could affect the working environment and well-being of nurses. There are 9 challenges encountered with the nurses in Northern Negros Occidental hospitals, and the overall assessment showed understaffing result is 89.2%. It is very high. It was very high, which indicates that there is a real need to promote the nursing profession in the industry to have a reserve army in case of emergency situation, particularly during the pandemic. The lowest rank among the issues was the low salary, representing 0.8%, due to the mass resignation of nurses related to overworked, low salary, and prefer to work abroad or in an alternative company that offers more competitive salaries. For the conclusion, a high quality working environment and a great extent of well being signified that the hospital management provided all their essential needs to handle and serve those critically ill infected patients based on the guidelines and standards set by the Department of Health. Nurses render quality care, compassionate, and dedication despite the risks and hazards encountered in the workplace. Additionally, nurses perceived their environment as positive, and their well-being was prioritized, resulting in delivering quality care to the patient. Moreover, prevent dissatisfaction, discontentment, and disinterest, which eventually lead to resignation from their job. Recommendations, chief nurses and supervisors. A program may be implemented in promoting and preserving the high quality of the working environment. Hospital chiefs may be encouraged to implement and support regular wellness programs for the nurses. Future researchers may be conducted as studies related to the working environment and will be able to compare the result of the present and the future studies. It is also recommended that the effectiveness of the proposed program be assessed. Impact or outcome of the study. This study significantly contributes to strengthening hospital management by developing and improving the quality of the working environment and the well-being of nurses. Providing a wellness program would improve the healthcare system and is expected to have accurate reporting of medical health problems and diseases, dangerous occurrences, and injuries. Original value of the paper. For future research may be conducted in other provinces on the impact of a quality working environment and the great extent of the well-being of healthcare providers. To encourage future nurses to investigate topics that could motivate and increase work satisfaction despite the risk and hazard they encountered in their work environment. To preserve the objective and purpose of the nursing profession in the community, also, a study may explore innovative ideas that may benefit future nurses and the development of good management for hospital sustainability. Lastly, improve the quality of life for both the patients and other healthcare workers. So there are 19 references I have cited. So thank you everyone for listening.